Pneumonia is an acute infection of lung parenchyma and distal airways that can be caused by different microorganisms, like bacteria, viruses, or fungi. And the source of infection is outside the hospitals. That's why it is called community acquired. It affects people in all ages and can manifest a variety of symptoms. The incidence of community acquired pneumonia varies between 3 to 11 per 1,000 persons annually. Pneumonia is usually categorized based on site of acquisition. Among all types, community acquired pneumonia is the most common form. Let's take a look at the risk factors of this disease and those who are at the higher risk of infection. The first and important risk factor is old age. The risk of pneumonia rises with age. The risk among adults older than 65 is 3 times higher than the general population, and the hospitalization rate is 2% among elderly. Patients younger than 50 years old are significantly at lower risk of hospitalization and death rate. The second risk factor is medical comorbidities. Those who have history of cancer, COPD, renal and liver dysfunction, or congestive heart failure are at high risk of infection and hospitalization in compared with people with no history of medical issues. Smoking and excessive alcohol consumption are associated with an increased risk of infection. Low income setting, living in a crowded place, and polluted air are other factors that increase the risk of getting community acquired pneumonia. The symptoms of community acquired pneumonia can widely range, and patients may present with different clinical presentations. Among all symptoms, some are common, such as fever, cough, especially productive cough, and dyspnea or shortness of breath. Actually, these 3 symptoms known as triad of pneumonia. Other symptoms include pleuritic chest pain, which is a sharp pain in the chest and worse with breathing, headache, myalgia, dry cough, loss of appetite, and sore throat. Severe pneumonia is when the patient presents with hypotension, altered mental status, sepsis, and respiratory distress. How to diagnose community acquired pneumonia? The combination of clinical manifestations, radiologic methods, and microbiologic tests help us diagnose community acquired pneumonia. Chest X-ray should be done in all patients suspected of pneumonia. Demonstration of infiltrate on chest X-ray is necessary for the diagnosis of pneumonia. However, radiologic findings are not specific and they can be shown among many cardiopulmonary diseases. We need to evaluate the benefits of microbiologic testing against its cost and time. Actually, in mild pneumonia and outpatient setting, microbiologic testing is not needed. But for all patients who are admitted to the hospital, it is necessary to obtain following tests: blood culture, sputum culture, urine testing for detecting Legionella and pneumococcal antigen, and complete blood count should be done to know if the patient has a low number of white blood cells. One important question is which patients need to be hospitalized. The Curve 65 method, which is a practical way with quite high sensitivity, shows us whether the patient should be hospitalized or should be taken to an intensive care unit. Curve 65 score is calculated by giving 1 point for each of the following features: C or confusion, U or blood urea nitrogen higher than 6 millimole per liter, R or respiratory rate higher than 30 per minute, B or low blood pressure, either diastolic less than 60 mm of mercury or systolic less than 90 mm of mercury, and 65 refers to age of 65 or more. If the score is 0 or 1, there is no need for hospitalization. If the score is 2, the patient needs to be admitted to take hospital care. And if the score is 3 or more, the patient should be transferred to intensive care unit. Sometimes, no matter what the Curve 65 score is, a patient must be hospitalized for a rapidly progressive pneumonia. This can happen in following cases: oral intolerance, mental illness, weak adherence to outpatient therapy, cognitive impairment, low socioeconomical state like being homelessness, and history of substance abuse. Patients who have been discharged from the hospital should be contacted within 1 week to determine whether they require a follow-up chest radiograph or any other management plan. To prevent getting community-acquired pneumonia and lowering the risk of infection, following tips can help: smoking cessation, influenza vaccination, and pneumococcal vaccination for at-risk patients.